medicine, and he's an expert in gastroenterology, University of Nigeria Teaching Hospital, Ituku Osala, in the person of Professor Slyvester Nwokediuko. Professor, thank you for joining us this morning on the program.
Thank you very much.
Yes. So, well, today we are discussing infectious diseases and epidemics with focus on hepatitis and its rising case in Nigeria. First of all, what exactly is hepatitis? Could you describe it in a manner that a layperson can listen to you and say, oh, this is what this is?
All right. Now, hepatitis simply means inflammation of the liver. Inflammation is the response organs of the body mount to injurious agents. The injurious agents could be infection, could be trauma, could be from chemical injury, but the underlying thing there is that the body mounts a response, which is inflammation. Okay. Now, when it is the liver, it is called hepatitis. Now, to come down to more basics, the liver is the biggest solid organ in the body, located in the right side of the abdomen or the tummy. You know, this is an organ that performs so many functions of building, chemicals, what we call synthesis, functions of breaking down compounds where necessary. For instance, it is in the liver that the glucose we have in the food we take is converted to the storage form called glycogen. It's also in the liver that glycogen can be broken down to glucose again, if the need arises. Other food substances like protein, lipids, that's fat, are also handled by the liver. The liver produces so many chemicals, plasma proteins, blood clotting factors. Blood clotting is something that takes place when you have injury to the body. The blood constituents will form a plug at the site where there is such injury to prevent excessive bleeding. Yes. Yeah. Now, that process of forming plug is not as simple as it looks. It involves complex, processes involving chemicals. It is the liver that produces most of those chemicals. About 11 or 12 of them produced by the liver. It is the liver that breaks down drugs that we take. It is the liver that breaks down hormones that we secrete so that they don't act excessively. So it is such an important organ that when it is inflamed, the result is usually not very good to the body. So again, hepatitis simply means inflammation of the liver. Now let me add a word or two on the causes.
Okay.
As I said earlier, it can be from infection, microorganisms, and by far the most important causes of hepatitis are the viruses, what we call hepatotrophic viruses, and they have been designated with the letters of the alphabet A, B, C, D up to E. These viruses, behave in different ways in causing hepatitis. Some of them may just cause an infection that will be short-lived, such as hepatitis A and hepatitis E viruses. They usually cause what we call acute infection that doesn't last for too long.
So they are usually self-limiting without treatment?
Well, yes, but occasionally they may be severe. But most times they resolve and the individual is cured. There is no long-lasting effect. As opposed to hepatitis B virus, hepatitis C virus, and of course hepatitis D virus that works together with B. These are viruses that tend to cause long-lasting liver inflammation, what we call chronic hepatitis. So when we talk of hepatitis, most times it is this chronic phase that we are worried about because of the tremendous morbidity and mortality. That is the disease they cause and their propensity to eventuate in even death. So that is why chronic hepatitis is very important.
Thank you very much, Professor. You've discussed on both the types of hepatitis that we have. Now, I'd like you to help us explain the symptoms. What are the symptoms you can find, and how can I differentiate from, okay, in quotes now, I have hepatitis A or B or C or D as it is. So what are the symptoms and how can I differentiate?
Okay. The symptoms of these various forms of hepatitis may be similar. Initially, that is during the acute phase. Some of them may produce what we call asymptomatic infection, in which the individual may not even know when the infection took place. Hepatitis B virus tends to do that, especially in children. Hepatitis C virus also does that. Now, some of them may cause obvious signs of illness in the early phase. So it's a spectrum. Some of them may be asymptomatic, while others may cause, noticeable disease initially. But generally, what you have is, in the acute phases, the individual feels unwell, loss of appetite, malaise, there may be fever, and all these may eventuate in yellowness of the eyes, which we call jaundice. And in fact, it is the appearance of this jaundice that makes both the patient and even the healthcare worker to suspect that it may be hepatitis, because the other symptoms may resemble flu, viral infection, or even malaria, but the appearance of jaundice is what actually indicates that you may be dealing with hepatitis. Some of them may also have abdominal pain, there may be vomiting, and for some, depending on the specific one that causes the infection, there may be joint pain and all that. But it is not possible on clinical grounds to say which of the viruses that is responsible, because the symptoms are similar. But if you want to determine which virus it is, then you have to do some tests. You have to do some blood tests, that will help you determine whether you are dealing with hepatitis A virus, hepatitis B, C, D, or even E.
Okay, Professor, someone listening to you now will be thinking, oh, maybe I have someone that has complained of these symptoms. What would be your advice to such a person? What is the first thing you're supposed to do if you have someone, or you as a person are experiencing all these symptoms and you've probably taken medication for malaria and things like that, and symptoms are still persisting? What is the first thing they need to do to make sure that they, nip this infection in the bud?
Yes. What they need to do is to go to the hospital or go to the clinic, as the case may be. If it's in the primary healthcare setting, if you go to the health center or to the clinic, so that those who are knowledgeable enough will be able to take history from you, perform physical examination, and then, if need be, conduct laboratory tests. This is very important because, as I said earlier, hepatitis B and hepatitis C viruses tend to cause long-lasting infection. And if undetected, they can remain in the body silently, continue to multiply, and in the end, the person will now come down with severe disease of the liver. And if the person presents at that time, treatment becomes more difficult, because at that time some significant damage has happen to the liver. So any opportunity one has to get himself tested is advice, yes.
Okay, so we know HIV is gotten through the transmission of blood and sexual intercourse. Yes, body fluids as well. We know Ebola has to be airborne and all of that. Now, for hepatitis, how is it passed? And also, how can people reduce the risk of contracting it?
Okay. Now, hepatitis A virus and hepatitis E virus are transmitted through what we call the fecal-oral route. So, you know, if your water or food is contaminated by a feces that contains the virus, the person gets infected. And that can be prevented by, you know, good water supply, hygiene, and for, of course, hepatitis A virus as a vaccine. Now, for B and C, and of course D, the transmission is parenteral.
What does that really mean?
Yes, what it means is that it is transmitted through blood and blood products. It's not through the mouth. So practices like unsafe injection, sharing needles and syringes, using body piercing instruments, tattooing and all that, one can get infected. But by far, the commonest route of transmission of hepatitis B in our environment is what we call mother-to-child transmission, which is vertical transmission. It is also transmitted horizontally, you know, from one person to another, especially amongst children. And this type of transmission is very important because it has strong relationship with the cause of the infection. Now, infections that are acquired very early in life through mother to child or from one child to another, very early infections like that tend to become long-lasting. They tend to become chronic in up to 90% of cases, because at this time the child's immune system is not strong enough to clear the infection. On the other hand, infections that are acquired in adult life only become chronic in about 5% of cases. So the time the infection takes place is very important.
Very critical.
Yes, and that is why a lot of effort has gone into the campaign to prevent mother-to-child transmission of hepatitis B.
Let's talk prevention of mother-to-child transmission. What exactly is the framework? Just give us an overview of the framework of this initiative to ensure that mothers do not transmit this infection to their children.
Okay, as I said earlier, in most of Africa, Southeast Asia, and even parts of the Western Pacific, the transmission is essentially through this route of mother to child. And if you can break that transmission or prevent it, it means the pool of infections that we get onto chronic phase will be drastically reduced. And so many countries have tried to do this by childhood immunization, you know, infant immunization, using the hepatitis B vaccine.
Hold that thought, Professor. So you're saying if a child contracts it from the mother, vaccination can clear it?
No, no, no. What we are saying is, if you vaccinate
the mother now,
if you vaccinate the child at birth,
okay,
it is the chances of getting it to be very much reduced, because this infection is not usually transmitted while the baby is in the womb.
Okay.
Yes, the infection takes place during birth, during the process of birth, yes, or more importantly, during early child, when the during breastfeeding, when the mother and the child are very close. Okay, so that is the time when this infection takes place.
Okay.
So if you immunize very early, like on day one of, on the first day of birth.
Is it part of the battery of immunization?
Yes.
Because we know of BCG.
It is.
Okay.
It is one of the immunizations that are given to
at birth.
Yes, BCG is given at birth. Hepatitis B vaccine, specifically now, should also be given at birth.
So you said should also.
Yes, within 24 hours. Now, you see, the guidelines have been evolving.
Okay.
There was a time it was said it should be given within the first week. Okay, but if you have high-risk mothers, mothers who already have the infection, or who have the infection are high and are highly infectious, as some of the tests would show, then it must be given within 24 hours to be effective. In fact, as of today, the campaign is for first dose to be given within 24 hours.
So it's still a campaign?
Yes, that is what is recommended even by the World Health Organization. But you see, like many other things in our system, the coverage in Africa is, okay, globally the coverage is up to 45% all over the world. So we don't even have up to 50% coverage of that scheme. Now in Africa it's less than 20%.
Leading to my question, sir.
Yeah.
Rather, Professor, with unlike HIV, the rest, Ebola, and the whole rest disease that we know, it is quite out there. People know about these things. A lot of people don't even know. Like half of the people who has hepatitis B, for example, don't even know that they have it because the symptoms are mild and not as the rest of them, the B, C, D, that are more dangerous. Yes. So how come we don't have much publicity about this? Saying that it affects something that is very important to the body, which is the liver. How come there is no much publicity about it? How much there is no much enlightenment to both people, both what's it called, schools about this?
Well, I agree with you that the enlightenment hasn't been as intense as it should be. But some groups within the country have also been doing their bit. For instance, I belong to the Society for Gastroenterology and Hepatology in Nigeria.
SOGIM?
Yes. And SOGIM has been on this campaign for years. Even before hepatitis B virus vaccine was incorporated in the immunization program, SOGIM was at the forefront of the struggle to get it to be, incorporated. Now, the World Health Organization has also been doing its bit. It has been working on several guidelines. In fact, the latest one came out earlier this year. But the political will by member countries to implement the recommendations has always been a problem. Funding has always been a problem because you talked about HIV. HIV received a lot of funding, and that went a long way to, improving awareness, advocacy, and engagement of the stakeholders, in the fight against HIV. The case with hepatitis, hepatitis is a little different, but people, as I said, Nigerian government has also done its bit, but I think they need to do more.
Yeah, I was going to ask, would you say that what they have done so far
is good enough?
Well, they have tried. In fairness to them, they set up a technical committee on hepatitis using professionals like us, people from the ministry and other stakeholders. And that committee has been working in collaboration with the World Health Organization, and I think we should commend that. And even the mother-to-child transmission, the figure I saw for Nigeria is above the global average. The global average is 45%, but I saw 52%.
That's just one indicator
for Nigeria, and that is I mean, if it is correct, then it's something to to applaud.
Yes, Professor. With the case of HIV, we are aware of the influence of PEPFAR. Was it Bill and Melinda Gates Foundation to the influx of all this foreign aid, yes. And that was why we had the outcome we had with HIV. But isn't it true that hepatitis is 3 times more effective than HIV? And if we're not getting those foreign aids and help, why are we not proactive, actively trying to see how we can get people involved, regardless of whether we get foreign aids or things like that?
Yes. Well, we within the limits of our capacity, I think we
are capable. Yes. We are professionals.
Yes, but that brings me to the issue of the theme of the conference for this year. That is time for action.
That should be your 16th conference?
I mean, the theme of World Hepatitis Day.
Okay.
Not conference, please.
Okay.
World Hepatitis Day, which is celebrated on 28th
of this month.
July, yes, that is tomorrow.
Yes.
And the theme for this year is time for action. Now, the statistics up to this moment is still not encouraging. For instance, over 300 million people in this world live with chronic hepatitis, both B and C. And of this number, Africa harbors more than 65 million. Okay, the rest are mainly in Southeast Asia. And the Western Pacific. So it remains a big problem. And most of these people who are chronically infected, as you observed earlier, don't even know they have the infection. And that means we need to test more people. Okay, it's time to test more people, because as you asked earlier, how would you differentiate one virus from the other? It's only by testing. And for these deadly ones that are chronic, you need to test. If you don't test, you can't make a diagnosis. And then you need to treat more people. There have been barriers to both testing and treating over the years. Very few people can afford to do the tests, what you call viral load, which is done by molecular techniques, very expensive PCR. To do. Yes. Then talking about the drugs used to be very expensive. Well, even today they are not cheap, but things have improved in terms of the cost of these drugs. But many people don't know their status, and even those who know, still fewer are on treatment. So it's a big problem. And in the latest guideline that WHO released, they tried to see how they can expand the criteria for treatment so that more people can get treatment. And then even diagnosis, they tried to make things simpler. It's simpler in quotes, because it's when we begin to operationalize these recommendations that we know how simple they really are. But they have tried to see if we can get more people to be tested, more people to be treated, so that the target of eliminating viral hepatitis by 2030 will be
achievable.
Yes.
Okay, so I'm sure most of our viewers watching right now wondering, okay, this is a scary topic, what can I do? So the question now is, are there vaccines to these things? And if not, which one or which of these stage does have the vaccines? Okay,
now hepatitis A virus, as I mentioned, does not cause chronic infection.
Yes.
But luckily there is a vaccine for it, which, though not part of the, our national immunization schedule, but a vaccine is available for hepatitis A virus.
Okay.
Hepatitis B also has a vaccine, which we talked about earlier, giving it to children, and then adults who are not exposed also need to have it, especially in this environment. Given if you give the 3 doses, the 3 recommended doses, it tends to confer long-lasting immunity to the recipient. Okay. Now, hepatitis C virus, which is another cause of chronic liver disease, unfortunately has no vaccine today. But the good thing about it is that it can be cured now. Hepatitis C virus, yes.
So just C.
Yes.
You now have drugs. Or is still on clinical trials?
The people have been treated and cured of hepatitis C virus.
Oh, good.
We now have drugs, effective drugs for that.
Okay.
What we call direct acting antiretrovirals. They are quite good and they lead to cure.
Well,
you just need to take the medication for about 3 months.
3 months.
Yes.
Now, speaking about cure, let's assume that somebody has this and probably did not know. What is the greatest complication that can happen to that person?
Very good question. For these chronic infections, especially by hepatitis B and C,
yes.
If the infection goes on without treatment, it can lead to what we call chronic hepatitis, which will, with the passage of time, get to the stage of cirrhosis. Now, cirrhosis is a very advanced form of liver damage, in which the liver, within the liver, you now have nodules. After the chronic inflammation, the liver tissue will become fibrotic, that is, scar tissue will form within the liver, and then you begin to have nodules within the liver. That has a lot of consequences, with regard to the function of the liver, both the blood flow and even the cellular function. So that cirrhosis will eventually lead to what we call liver failure. And that is the next step is death. Now, you can also have the infection leading to liver cancer. In fact, for hepatitis B virus, it may lead to liver cancer without going through the stage of cirrhosis.
Direct precursor.
Yes. Then for C, it usually goes through the stage of cirrhosis before it gives liver cancer. So both of them have that tendency to cause liver cancer.
All right, just as a follow-up, you mentioned convalescents, if that is the right word, people who do not experience any symptoms of hepatitis is against people who do experience the symptoms. Now, those people who do not have the symptoms, is the prognosis still fatal? Are they still going to still experience all these stages of degradation of the liver, or they just live out their lives without even knowing that they were infected in the first place?
Well, as I said, what determines whether it will become long-lasting for hepatitis B is the time of infection. Those who get infected very early in life are likely to get on to the chronic phase. And if they are not picked up and the intervention instituted, they may get to that late stage. Okay? And the only way to pick them up, even if they started as asymptomatic infection, the only way to pick them up is by testing the blood.
Could it be advised that testing for this, because there's this random test kits that you can use to test on the spot, could testing for hepatitis be one of the battery of tests for vital signs? Could it fall under tests that are done as vital signs to ensure that any patient that walks into the clinic gets tested for hepatitis?
Well, there is no way it can be part of vital signs, but it's an important test that anybody who is going for routine medical examination, some people do tests before they get married, before they get employment, before they enter school. These are opportunities to test them for hepatitis infection, both B and C, especially B. The reason is that Nigeria is still in a high prevalence, place. Anywhere the prevalence is 8% and above is high. And everybody living in that community, should get tested as soon as possible to know your status. If you are negative, you are encouraged to take the vaccine and to also maintain the universal precautions that we use to prevent diseases generally.
So, Prof, I would like to ask, we've educated people about this disease, infectious disease called hepatitis. Now, how can we encourage people to do this test? Because I don't want to say, but we know Nigerians and how it is when it comes to their medical and healthcare part of their lives. But how do we encourage people to tell them that this is important?
Yes. You see, that is part of the reason this World Hepatitis Day was instituted. So that on every 28 July, stakeholders, by stakeholders I mean governments, professionals, patient groups, indeed the general public will, we will get involved in creating awareness about this. And what you're doing right now is part of it. In some years we've had to carry this campaign to churches, and sometimes we even sometimes we embark on free testing for people, and after each exercise you see that a good number will come up and present themselves subsequently for treatment. So it's a campaign that should involve everybody. You in the media, you are doing your best. Traditional rulers, the political class, professional bodies, everybody.
Okay. Finally, Professor, from my own end, just in 1 minute, tomorrow is the day. Can you tell us what the plan is? Probably here in Enugu, what is the plan for Hepatitis Day 2024? The plan, unfortunately, this year's event is on a Sunday. So it may not be possible to do much on a Sunday, but we have put up some program in our hospital. We tried this time around because of the resources to do more. We decided to limit it to the hospital. So we are going to move around the hospital. Patients that have come to hospital for other reasons, while they are waiting to see the doctor, we intend to speak to them,
so it's
show them some
internal,
flyers. Yes,
nothing outside of
yes,
that.
and then it's something that we don't always wait for World Hepatitis Day. Sometimes we do sporadic things. Okay.
All right, sir. Thank you so much for your time and coming into the studio to educate us and the viewers on hepatitis, but we are afraid this is the much we can take, but we had a great time. All right, if you're still here with us, we are going to go for a short break, and when we come back, Vox Pop. Stay with us.